Doctors and surgeons of Reddit, what was your "this just got even worse" moment with your patients? Once, I had a patient that had to be flown in from another state for escalation of care. She was a middle-aged woman with no prior medical history, and she was transferred for intracranial hemorrhage. Pretty standard stuff. What was nuts was that, as per her family, she tried smoking weed for the first time in her life and she coughed so hard that it ruptured a vessel in her brain. She survived the surgery, and during her post-operation recovery, her heart stopped, and she went into cardiac arrest. I was at the code blue with neuro, pulmonary, and for rapid sequence intubation and ACLS, and we were able to bring her back. Right as everything calmed down and everyone had packed up and left, I was just chilling outside the room, reviewing my patient list, when she went into cardiac arrest for a second time. Everyone had to sprint across the hospital again to handle it. I've never seen the code blue team so out of breath. She had a ruptured aneurysm, hemorrhagic stroke, 2 cardiac arrests back to back, and lived. This was when I was an anesthesia resident. A pregnant woman comes into our medium-sized community hospital in the Canadian West in the night with some abdominal pain and nausea, something minor. Her doctor determined she was not in labor, so just treated with some meds and she started feeling better. She was about to be sent home in the morning, when the new obstetrician for the day noted that the patient's blood pressure had dropped. The new doctor felt the patient's uterus and it was exquisitely tender, and the patient is feeling very faint now. Now, the diagnosis is likely uterine rupture. So, she was rushed to the operation room for an emergency C-section, and that's where I get called in to help my staff. Uterine rupture is bad enough, but when they get in there and remove a tiny preterm baby, they discover that it wasn't a uterine rupture but a placental precreta. That's when the placenta grows through the wall of the uterus and into the surrounding organs, in her case into the bladder. We rush the patient from the smaller floor to our biggest OR, call in more surgeons including a urologist, and me and 2 other anesthesiologists start a massive blood transfusion protocol as she's bled so much. This condition is usually able to be screened for a prenatal ultrasound, but the patient had skipped hers. If known beforehand, she likely would have been sent to Toronto for the risky and delicate surgery. If she had gone into labor to try to deliver normally, she would have very likely died. She and the baby did totally fine. A couple hours after her several-hour surgery, she was awake and chilling with her healthy baby. Young woman in her 20s comes in with an infected heart from injecting drugs. Her infection and heart failure are pretty much past the point of recovery. Her only option was basically 4 antibiotics, hope they work, and if they don't, go to hospice. The antibiotics got the infection somewhat under control. But the heart valve damage is too much. Her heart starts throwing little microclots. Her fingertips got purple, and she eventually throws clots to her lungs and starts struggling to breathe. She comes to my ICU for BiPAP. She decides to make herself a DNR, do not resuscitate, and proceed with hospice. But in my state, DNRs and living wills don't mean crap. Once you become unresponsive and your family member takes proxy. Her mom, who she was not on good terms with, went to court to receive healthcare proxy rights, once she became too disoriented to maintain capacity for medical decision-making. Mom rescinded her DNR. We intubate her. She spends months on the ventilator throwing clots despite heparin. Her arms and legs become purple, black, green, necrotic. Her abdomen even started to break down and come necrotic. She threw clots to her brain and became totally unresponsive, no longer requiring sedation. We took the case to risk management, we held ethics meetings, we went to court against the mother to revoke her healthcare proxy to fight for the patient's right to die with dignity. The court refused. Mom remained proxy. The patient eventually coded. I initiated CPR and ran her code with the physician. Performing CPR with so much necrosis was beyond disturbing. She did not survive. Things became problematic in the morgue a few days later. I had to go to the morgue and add a secondary body bag to contain everything. Patient, not doctor. My boyfriend had come home from a family vacation on a farm in Kansas. He developed hives within a day of his return. He went to the doc and was told hives weren't contagious, so we didn't take any precautions. A few days later, I was covered in hives. I went to my doc who said hives aren't contagious, but that he must have had some pesticide or something on his skin, told me to come back if they changed color or anything. I was on my way to work, hot summer day. I looked down and my legs were purple. I changed route to the doctor immediately. I was sweating and could see every trickle of sweat turn into a new hive. The places I'd had previous tan were now all purple. I came into the office and the doc was more than alarmed. Started calling in his colleagues, pulling out medical textbooks. They gave me a bunch of antihistamines, put cool clothes all over me to stop the sweat. The hives went back to pink, but they never did give me a diagnosis. Just to stay cool and take lots of Benadryl. The hives ended up peeling. I had to take a bunch of time off work as I was in food service at the time, and no one wants a waitress who looks like a leper peeling skin everywhere. Had scars for years everywhere that I'd had a previous tan or sweat had trickled. Evisceration is always a great surprise on rounds. Imagine walking by your post-op patient and seeing their intestines out. The worst was when I got called into the ICU by a nurse saying, there was bleeding coming from a guy's neck. He just had surgery on his neck after getting stabbed there. Walk into the room and they are holding pressure. I take down the bandages and blood starts shooting out of his neck. Was a decompressing hematoma. Turns out they didn't fix one of the holes in his carotid. Another guy got stabbed in the neck, had low pressure when he arrived. As we give him blood, he starts pouring it out of his neck. I am holding pressure hard as we run to the OR. Transected his jugular vein. He lived. Another guy got shot in the chest. Initially, he was okay. But then, he starts dying in front of us. We crack open both sides of his chest and clamp his lung, where the blood was leaking from. He was talking to me a day later. He went home to see his newborn 2 weeks later. I was a resident in ICU, and we had a patient recovering from Stevens-Johnson syndrome, rare drug reaction where skin blisters and dies. He also had a clotted femoral pseudoaneurysm, basically a bulge in the femoral artery, that's at risk of bursting and bleeding. Between afternoon and evening rounds, this patient's nurse asked me to assess the patient's leg, because it seemed to be swelling. His whole body was swollen because of all the inflammation he had and fluids he'd been getting for his blood pressure, but his right leg did look more swollen than a few hours ago and the skin breakdown was worse. But his aneurysm was stable on the ultrasound earlier in the day, so it didn't seem like there was much to do other than keep it well dressed and monitor. A couple hours later my co-resident, and our fellow were doing our evening rounds as the general surgery team is assessing a patient a few doors down. The leg looks even worse than earlier, another few centimeters swollen, and more skin breakdown. All his vitals are okay. He's on appropriate therapy. The three of us, plus his nurse, are trying to decide what to do, when right in front of us, his leg splits open and blood comes pouring out. For an instant, I think maybe this is just some subcutaneous hematoma that's burst, but then I see more blood rapidly bubbling out of his leg. The nurse and my co-resident throw on gloves and apply pressure while the fellow grabs a surgical kit and tries to find the source of the bleed. I rep down the hall and grab the surgeons who are still evaluating their patient, and within 2 minutes, there's a small team of surgeons gowned and gloves searching through this man's leg looking for the bleeding vessel. Another minute or two later and they've found the vessel, a vein, and stopped the bleeding as best as they can. I think, on the repeat blood work that evening, he lost maybe 10 to 20% of his blood in that 5-minute period. The problem was the infection now. He was pretty sick and frail to start with and had already had a near-fatal reaction to one class of antibiotics. But now, when his leg burst open and started bleeding out, there was no time to go off and grab sterile gloves. We just had to throw on the gloves we had and apply pressure. His wound became purulent, and he developed bacteria in the blood. With all the other medical problems he was having, it was just too much and he ended up going palliative. Had a patient last week, who had an avenue fistula placed for dialysis. Essentially, we create a link between artery and vein, which gives good access for the dialysis catheter. He kept picking at the wound and so the skin didn't heal over it. Ended up creating a pseudo-aneurysm with the wall of the fistula, poking through the skin looking like a little tiny 4mm blood blister. We are looking at it in the office, trying to figure out what exactly we should do about it, when suddenly it pops. The patient was sitting in bed and the blood sprayed so high over our heads, it hit the ceiling and we had time to move out from under it as it fell. Nobody got sprayed on by some bloody miracle. Now, we put pressure on the wound, which is spurting blood several feet in the air with every beat of his heart. We end up placing a tourniquet and taking him to the OR emergently. Guy leaks like a sieve the entire operation, but eventually we managed to repair the fistula and close the skin, nice and clean. Very much a no-shit scenario but with a good outcome thankfully. I saw a patient on the medicine service, who had a history of kidney cancer, now in remission. He comes in from an outside hospital with some imaging, allegedly showing a focal mass in one kidney. It doesn't look like it's spread. If it's actually just a focal lesion, we can chop off the tip of his kidney and cure him while retaining most of his kidney function. Bad situation, but not awful. Surgeon wants better imaging, so we send him to radiology pre-op. We pick up the phone and speak with the radiology attendant. The cancer has spread just a little more than we thought, now to involve the renal veins. Essentially taking him from stage 2 to stage 3. Okay, not bad but still not terrible. We can work with that. Then the radiologist mentions, he sees shadows in the liver and brain. After the dust settles, everyone agrees that this man actually has severely metastatic disease, stage 4 and very advanced. The worst part, in my opinion, was telling him. Remember, this man came in thinking he would likely have a short surgery and go home cured. The surgeon walks in and says, "I'm sorry John Smith, but the cancer has spread, and you most likely have about 6 months to live." His son, about 5 years younger than me, was standing there next to him when the lead surgeon told him. This was about 2 years ago now. I often think about that man and his son. I find human brain still hoping he was the miracle exception, but Dr. Brain knows that probably didn't happen.